Did you know that many infections like malaria, mononucleosis, or even certain bacterial illnesses can silently cause your spleen to enlarge? Yes, an enlarged spleen, also called splenomegaly, isn't just uncomfortable, it can be life-threatening if ignored. Millions of people suffer from spleen enlargement without even realizing that the root cause could be infections. Here's the burning question. How can you tell if your enlarged spleen is linked to an infection before it gets worse? Stick around, because in this video, we will break it down step by step, and you will be amazed at what your spleen might be telling you. First things first, why does your spleen swell when you get an infection? The spleen is like your body's immune superhero. It filters blood, removes germs, and stores healthy blood cells. When an infection hits, the spleen goes into overdrive. Immune cells multiply, blood flow increases, and the organ swells to handle the extra work. So, whenever you hear spleen enlargement, remember, your spleen was fighting an infection. It was not just sitting there. Now, you're probably asking, which infections are most likely to make my spleen swell? Before we dive in, please take a second to like this video and subscribe to our channel. It really motivates us to create more helpful health videos. Thank you. Let's go straight to the main infections that can enlarge the spleen. 1. Viral infections. Viral infections happen when viruses invade your body's cells and multiply. Common examples include hepatitis, mononucleosis, HIV, and even some flu-like viruses. These viruses push your immune system into overdrive. The spleen filters infected blood cells, produces extra white blood cells, and stores them to fight the virus. All this extra work makes the spleen swell, causing enlargement. In simple terms, viral infections overload your spleen, and the harder it works, the bigger it gets. 2. Bacterial infections. Bacterial infections occur when harmful bacteria invade your body, multiply, and release toxins. Common ones include tuberculosis, syphilis, pneumonia, and sepsis. When bacteria spread in your bloodstream, the spleen acts like a super-powered filter. It removes bacteria, clears out damaged cells, and produces more white blood cells. This non-stop workload causes the spleen to swell. Simply put, bacterial infections push your spleen into overdrive, and the harder it works, the larger it grows. 3. Parasitic infections. Parasitic infections happen when parasites, organisms that feed on a host, invade your body. Examples include malaria, leishmaniasis, and schistosomiasis. Parasites attack the blood or immune system, forcing the spleen to filter out massive numbers of infected or damaged cells. At the same time, the spleen produces extra immune cells to fight back. This overload makes the spleen swell, sometimes dangerously. Here's the curious part. In some regions, repeated parasitic infections can keep the spleen permanently enlarged. Could your lingering spleen discomfort actually be a hidden parasite at work? Comment below. We would love to hear your thoughts. 4. Systemic infections. Systemic infections spread throughout the whole body rather than staying in one spot. They can be caused by bacteria, viruses, fungi, or parasites. Examples include sepsis, HIV, and widespread fungal infections. Because these infections travel through your bloodstream, the spleen is constantly exposed to germs and toxins. To protect you, it works non-stop, filtering blood, destroying infected cells, and producing more immune cells. This constant activity causes the spleen to enlarge. By the way, how do you know if infections are the ones causing your spleen enlargement? This is how. Here are key warning signs to watch for. Number 1. Pain or pressure under the left ribs. As the spleen swells, it pushes against nearby organs, causing discomfort or pain. Number 2. Fever and chills. Ever wonder why your body suddenly feels hot and shaky? Fever and chills can signal your spleen is overworking to fight infections. Number 3. Fatigue and weakness. When your spleen works over time, it drains your energy, leaving you feeling exhausted and weak. Number 4. Early fullness after small meals. Feeling full after just a tiny meal? That's your swollen spleen pressing against your stomach, reducing its space. Before I forget, a patient of mine asked me, why knowing all this information about enlarged spleen and infections matter? Here was my reply. A swollen spleen isn't just uncomfortable, it's risky. If infections keep it enlarged, the spleen can become fragile, and a sudden rupture could cause life-threatening bleeding. That's why linking spleen enlargement directly to infections is so important. You can't just treat the swelling, you must treat the infection causing it. There you have it. So now you see the strong connection between infections and spleen enlargement. Viral, bacterial, parasitic, or systemic infections can all make your spleen swell, causing pain, fatigue, and other warning signs. The good news? You can protect your spleen by preventing and treating infections early. Stay aware of symptoms, maintain hygiene, eat healthy, and see a doctor when needed. Take action today to fight infections and keep your spleen healthy. Your body will thank you.